Honorable Secretary, Additional Secretary, Mr. Rajendra Kumar, Dr. Devi Shetty, Dr. Neena Pahuja, members from the medical fraternity, and industry colleagues. My name is Subrato Das. I represent a company called SAP in India, and I'm here joined by my colleague, Mr. R.P. Singh Dadiala, who handles the central government and defense for SAP. This is the 20th year of our existence in this country, of the 43 years that SAP has been in this world. And in the last 20 years, we've taken the Indian public sector and the Indian public services to an area where they can now start getting benefits from digital interventions and digital transformation. So today my topic is about the digital transformation of healthcare. I handle public health, public education, and public services as an industry practice. And today I'm going to talk about SAP's offerings in the space of public health delivery. A little bit about our experience, our credibility in the healthcare segment. And I'm not going to repeat what's there on the slides because it's there for you to see. But organizations such as Mayo Clinic, Cleveland, Johns Hopkins University, Charité in Berlin, the state public health delivery systems for states of Israel, Singapore Health, Austria, Germany, Denmark, run SAP as the core of the clinical, patient, and ERP transactional systems. So that's the credibility that we bring on the table today, irrespective of the fact that the entire healthcare ecosystem, represented by healthcare service providers, biotechnology companies, healthcare device manufacturers, pharmaceutical companies, most of them run SAP as their transactional base. Our healthcare practice consists of 4 different quadrants of solution offerings. Out of the 2 main quadrants are the SAP patient management system, which deals with the time a patient gets into a healthcare facility till the time a patient goes out and probably comes in back again. The entire life cycle of that patient is managed within the clinical and the patient management system of SAP, which includes the EHR and the EMR for that particular patient. The second quadrant, the leading quadrant, is the SAP Connected Health Platform. An SAP Connected Health Platform is about driving an integrated platform wherein you have solutions like the patient management, like the clinical management, which together some of you may want to call a hospital information systems. It has got EMR and EHR of its own, but it also connects onto disparate heterogeneous data sources by which EMRs and EHRs lying in other systems can be culled into, and a single electronic health record for a citizen can be created. It is based on a big data platform called HANA, which allows you to take information from multiple data sources to build something known as SAP Medical Research Insights, by which you can develop personalized medicines, develop evidence-based prescriptions, evidence-based drugs, and evidence-based clinical pathways for patients. The health engagement platform by which you can connect onto devices like Fitbits and other things, but you can also connect to devices which are able to communicate. Let's say, for example, about 2 years back, we did a pilot project with Roche, which manufactures the AccuCheck diabetic machines, the hypoglycemic indicator machines, wherein we used a low power emitting Bluetooth device, and we connected that onto the cloud by which you could understand the blood sugar levels of a patient, especially with patients who are geriatric, and changes in the glycemic hypoglycemic levels could mean different things for different patients. So we did that over a patient base of almost 12,000, 15,000 patients, and it's now available as a product. Also, what we are able to do is drive connectivity between a community, or let's say a geriatric community, or a community with physical challenges, and drive medication and healthcare from them based on the information that we drive. Also create a peer-to-peer platform by which all these patients could share information, talk to doctors and clinicians, and talk to caregivers, and create a gamification platform by which wellness as a parameter can be driven for these communities so that they lead a healthy life. So this essentially completes the SAP healthcare solution offering. Of course, we have the SAP ERP at the back end, which takes into account the financials, the medical supply chain, the human resource and human capital management issues for every healthcare service provider or entity. A little more about the SAP Connected Health Platform. First and foremost, I would like to talk about how we generate our own EMR, and we also connect onto disparate data sources or disparate HIS systems which generate their own EMRs. And we combine that and we create an electronic health record by using a product known as eCare Data Connect, or EMR Data Connect as some people like to call it, wherein we take sources from offline sources, online sources, get them onto a master data management layer, and create a unique electronic health record for a particular citizen. Next, we have the database, which is the HANA, and it is an in-memory database where we drive the analytics, not only analytics for what is currently happening or what has happened in the past, like say for example the prevalence of a particular disease in a particular area, or analysis of the efficacy of a certain government program across a larger population, but also drive predictive analytics by which we are able to, using algorithms which can be built on this platform, drive predictive analytics outcomes for public health officials to understand there could be a possible outbreak of a particular disease in a particular geographic area, and it can be viewed with a GIS database by which you can understand your health resources there, availability of primary healthcare centers, availability of certain types of drugs, the population in the hinterland, the economic parameters by which you are in a position to take decisions based on outbreaks that could possibly happen in the future. It also allows you to integrate partner applications which have been built on this platform, but also partner applications which are not built on this platform, using the process orchestration engine that comes along with the HANA Connected Health Platform. But more importantly, let me spend a little more time in trying to understand how this SAP Connected Health Platform kind of aligns to the visions of the Health Ministry from the point of view of the key performance indicators that it wishes to see in its integrated health information portal. So first and foremost, creating an electronic medical record for the citizens. Irrespective of what EHR, EMR data I'm getting from the SAP system, we have to be realistic that there would be multitude of these systems available in India. There could be systems built by CDAC, there could be systems which private healthcare operators are using, or systems which are developing over a period of time. They could be on certain data formats like SNOMED CD. They could be in ICD-9 or ICD-10 formats. So culling all of that, creating a master data management level, doing deduplication data services and data quality checks on them, and creating an electronic health record to provide continuum of care to the citizens is something that we drive with the connected health platform, which is the part one of this particular architecture. Next, as I talked about, the third-party applications that can be built, which kind of aligns with the value-added CAFE services that the IHIP portal wants to kind of provide to the citizens, wherein third-party applications can be hosted on this, and also applications which are currently on-premise or on the cloud can be integrated using the business orchestration platform. Next is the comprehensive analytics platform, not only regressive analytics, but also analytics going on to the future, not only analytics on systems of record, which are transactional data, but also analytics on geospatial data, analytics on streaming data, analytics on mission data can be performed, and predictive algorithms can be built using this particular platform. The next is the portal services. Now again, the portal services that we provide does not restrict you to a particular computing device, whether it is the laptop that you are using, the notepad that you are using, or the smartphone that you are using. Based upon your roles and privileges within the healthcare ecosystem, you would have content which is driven down to you. Or whether you are on the headphone or whether you are calling through the portal services or Skype or some other device, we will provide you an omni-channel experience using the portal infrastructure that is provided within the HANA Connected Health platform. And last but not the least, the disease research, genome research, personalized medicine, and patient engagement, which takes it to the social media platform. Now, the disease research, the genome research are probably things that can go on parallelly or can come at a wave 2 or a phase 2. But this is, to basically articulate that the, current, the future, and the, and the developments that can be foreseen in the distant future can be integrated using this particular healthcare platform. So how does that particular piece wherein we collate data from multiple sources work? We take systems, we take data which belong to certain proprietary standards or certain universally accepted standards for defining clinical data. We get that into SAP Connected Health platform using the connectors and the gateways and the master data management systems that we have. And you can integrate that with various applications. The right side of the screen may not be immediately relevant to you, but the left one certainly is. The benefits, I know I am probably overshot my time here, deeper insights into not only the overall public healthcare delivery system, but deeper insight into one particular unit of the population or one citizen. Faster innovation, developing different methods of public healthcare delivery using certain tools and techniques that are already built in within the platform, collaboration with a wider healthcare delivery ecosystem, and extending the applications to the partner community or third-party applications, and having full strategic control over your healthcare delivery platform are the 4 or 5 key performance indicators that the SAP Connected Healthcare platform provides. So that's it from my side. I would welcome any questions that you might have in this.